Alistair, we're going to talk about your left knee today, but first of all I wonder if you just give me a little bit of your sporting and working background.
I've played sport all my life, played decent amateur sport in cricket and hockey, effectively from school, trained every day, played every day through up to university. I worked for a sports company which gave me good insight into all the problems and all the footwear and everything that was required, and so I reckoned I've had 45 great sports years, and inevitably something was going to give in your body.
And then it reached the point where you came to see somebody at Yorkshire Knee Clinic, saw Mr. London.
He offered me a new option which was called a KineSpring.
Had it occurred to you to consider something which was undergoing trials and was really quite a new procedure with some early promising results, but nothing proven in the long term? What were your thoughts on trying out something new?
In truth, I walked in thinking absolutely not. My physio, who had worked with Mr. London, had told me my knee was finished, something needed to be done. You would have the pain unless something was done. But in truth, I didn't think a new operation was possible. I thought it would be a new knee. Did
you have to go away and think about things for a long time? Were you given a lot of information about it?
I was given a lot of information. I was told to go away and really think about it, which I did for about a month. And what I liked about it, and this was the important factor, was that I was considered young for a new knee. This was an option because I was still fairly fit. And I liked it because it was not too invasive, that they could do it, and if it didn't work, it could have come out and I could have had my new knee, and that wouldn't have been a major issue. And that actually allowed me to sort of think positively about the new KineSpring operation.
So you went in for the surgery. Tell me what the experience of the surgical treatment was like.
Very interesting, really, because I've never had a major operation. It's the first one in my life that I've been cut open and operated as such. Mr. London had given me all the updates saying we just literally slip the spring in. He'd show me what it was. I didn't see how they could do it, but they did. And it went extremely well.
So you were in hospital just for one night?
One night only, yes.
And talk me through the recovery after that.
I got home, I put my leg up for 3 days. That's what he said. Thereafter, I then started to do the exercise that I'd been told to do. And I was astounded how quickly I was able to get on a bike and rotate my knee. I couldn't believe it. And I was going every other day. I was doing rest, train, on a bike, very slowly, and within 2 weeks I was actually cycling again.
How long do you think it was before you could distinguish the surgical pain, if you like, settling down, and notice an improvement in the pain that you'd gone into hospital with?
I would say about 4 or 5 weeks. It was lambing time, and there was a lamb out on the road, and my young Labrador ran after it. I was horrified, absolutely shot after my Labrador, got him, then suddenly realised that I had actually run. I couldn't believe that I'd done it. No pain, didn't hurt.
So it's pretty well 3 years from the operation now, and you told me about the sort of sports you used to enjoy doing. What have you got back to in terms of sports in that time?
I didn't expect to go back to playing cricket. I had retired, but I wanted to be able to ski again, to walk, to do all the, the everyday life things without having pain. And I skied 3 months after my operation. Just recently, I've skied twice, 2 separate weeks, and it's been absolutely incredible.
Trialling new operations and implants and procedures is very important for the progression of surgery and medicine, but in this case knee surgery. What would you say to somebody in a similar situation to yourself?
I would say you've absolutely got to look at it, and the key is, if you're dealing with the right professionals, you can get all that information. It has worked and has allowed me to do things I couldn't do before.
I should mention that I know you've also got a little bit of trouble in your right knee. And what are your thoughts on treatment for that knee in light of your experience with the left knee?
I would be quite keen to have another KineSpring operation, but I would certainly wait until I've had this one for 4 to 5 years, so that there was a little bit more data available.
So overall, looking back, did you make a good decision to have it done?
Definitely.